In search for the cause of health, not disease, the Innate Doctor will be interviewing elite athletes, health professionals, scientific researchers, authors, and high-performance coaches to help understand where health actually comes from. If you want a simpler understanding of health, happiness, and longevity, you've tuned into the right place. You're listening to the Innate Doctor podcast, and here's your host for this life-changing episode, Dr. Trent Headlam. Have fun getting healthy.
And welcome back to another episode of the Innate Doctor. And this is the first time we've had a dentist on the show, which is probably a little bit strange to some people to think that dentistry has something to do with our general health and well-being and becoming more awesome. But Dr. Dan Hanson is no ordinary dentist, and he has a huge wealth of knowledge to share with the world, and is doing that as we speak. Creator of the Sleepy Strip, a butyric breathing instructor, works with non-braces structural orthotics, meaning that helping create and change crooked teeth and jaw malformations without braces at all, and really getting to the root cause of decay, of crooked teeth, etc., instead of just treating the symptoms. And doing it in the most holistic way possible. Is the co-founder of Heal Dental Care here on the Gold Coast. And he really just is on an absolute mission to change dentistry as it is, and have a completely different perception of how our teeth and our breathing and our jaw and our tongue impact our entire health and lives, and is doing amazing things with little bubs as well, with tongue ties, which is a very underdiagnosed, I guess. I don't like to use that word diagnosed, but oftentimes missed problem that kids have, where their tongue hasn't developed properly, and they basically are going to be having things like difficulty breastfeeding, swallowing, breathing, all of those things, and this can be a problem that adults carry with them. And so Dr. Dan Hanson is doing some amazing work in that. He lectures all over the country. So without further ado...
Okay, I'm co-founder of Heal Dental Care. What I specifically do is more sort of what most people wouldn't expect a dentist to be doing. So my business partner here does the dentistry side of it, but we do it in a most comprehensive way that we can possibly fathom, in a way that's more biocompatible, and for want of using a better word, maybe a holistic way, in that we try to search for as many ways of helping people to achieve their health goals beyond just healthy teeth and gums. Mm-hmm. With regards to what I do, I work on more often with babies, but also with all ages, to do something called tongue tie procedures. So babies specifically who are having breastfeeding difficulties. And the other side of my work here involves being a breathing educator, which isn't dentistry. It's helping people with stuff like snoring, sleep apnea, congestion, asthma, those sorts of things.
Yeah, okay, that's awesome. And Dan, is there many dentists doing the type of work that you're doing, or...?
With regards to my side of the work, like the tongue tie things, those sorts of things, there are, but nowhere near as many as doing other sides of dentistry. So there's specific protocols that I use, which have been developed by a wonderful colleague of mine, Dr. Martin Jones. Those sorts of protocols are not being used readily, and Martin and I have people flying from all over Australia to get those things done because of the specific protocols that we use. But we are in the process of teaching the profession about how to do that, so there will be more dentists doing those sorts of things soon.
Yeah, okay, cool. And so, excuse my ignorance, but just give me a background about, like, I guess the difference between what you do compared to a normal dentist, because when I think of dentistry, you think of like drills and fillings and mm-hmm. all of those sort of things. Are you doing something that's, good to do in combination with that traditional type of dentistry, or is the type of work that you're doing really replacing traditional dentistry altogether?
Yeah, well, what we do, what the other dentists do at Heal Dental Care, Certainly does a lot of the time look like traditional dentistry. But when we do it, we use as many materials that are more biocompatible as possible. So, for example, instead of having a resin filling, although you could still have that with us, like a white filling, we make CEREC fillings, which is a milled porcelain filling, which is made here on site with a 3D printer that 3D grinds this filling out after having scanned the tooth.
Wow.
Those sorts of things. And we use other high-tech equipment like lasers and various things like that. So I don't personally do that stuff anymore. That's what my partners and the associates here do. As I say, my stuff's specifically on the babies.
With the tongue tie, exactly, for those who are listening who are not familiar with what that actually is, do you mind just explaining what a tongue tie is?
Yeah. Tongue tie is a funny old term. So traditionally people think about tongue tie as a tongue that's completely attached to the floor of the mouth, but we like to use the term now oral restriction, which means that the little frenum, which is the thing underneath the tongue, which attaches the tongue to the floor of the mouth, sometimes that's not elastic enough, or it's too short, or it's too thick. Basically, it means the tongue can't move and function in the way it was supposed to. It's amazing. What's supposed to happen is the tongue should sit up in the roof of the mouth, and by pushing on the top jaw, it helps to develop and grow the top jaw. And when the top jaw grows properly, we then allow room for the teeth to come through. When the tongue is restricted, the other muscles like the cheeks and the lips get involved in things like swallowing, and that change in function affects the form. So function affects form. So I see the muscles of the cheeks, the lips, and the tongue kind of like a sculptor, and the teeth and jaws are like a big lump of clay in a growing child. And so when the tongue can't elevate into the roof of the mouth the way it's supposed to, the other muscles like the cheeks get involved and they kind of squash the jaw. And so you get this high palate and a narrow jaw forming, as opposed to a normal palate and a correct jaw, which then allows the teeth to come through properly. So by getting in really early, I had a baby the other day who was only 26 hours old. And I did the procedure on that baby, and now that baby's got a really good chance of developing a good normal swallowing pattern, so that then they can go on to hopefully grow well-formed jaws and breathe properly and all the rest of it.
Because it'll affect everything, won't it?
Yeah, I mean, breastfeeding basically sets up for swallowing patterns and breathing patterns. So, if we get breastfeeding happening correctly early on, then we set these children up for a much better chance of growing jaws properly.
Yeah, cool. Yeah. And so what are the type of symptoms that parents could look out for? Is it something that's just super obvious, or can kids have these things and parents not know for a long time? Or how does that work?
Yeah, I mean, sometimes I'll get babies come to me after sort of 11 months of trying, and we end up, unfortunately, having to do the procedure on an 11-month-old, but really we want to do it early on. And typically the symptoms are often things that people just think are often normal. So babies with colic, for example, or reflux. So if you're taking in air because you can't get an adequate seal around the bicularis oris, around this muscle around here, if you're taking in air while feeding, you're going to get some kind of windiness and gassiness and indigestion, and that's going to lead to pain, and then you can get symptoms of colic and all those sort of discomfort and crying that babies often do. So often these things that are accepted as kind of normal often are in disguise, and my view is basically that it's actually, the norm is actually for breastfeeding to be actually quite a pleasurable experience for both of the dyads, so mum and baby. It should be quite pleasurable.
Yeah.
And when it's not, the reality is that a lot of the time, so painful feeding, gassiness, wind, colic, all these sorts of symptoms, they're there for a reason. I believe that symptoms are gifts. The symptom is the gift the body's giving us, saying that there's a problem, and sometimes it's possible to look at that problem and do something about it.
Yeah, that's awesome. And I mean, most people just take, I guess, irritability for their bub or crying and, not keeping food down and all of those things, and heaps of gas is just, okay, well, it's just, it's a newborn, so that's just like normal, quotation marks. But it's not really, is it? And if, I guess we can get more people educated on things like tongue tie and other things like that may be causing the irritability. Thousands, if not millions, of mums and dads worldwide don't have to suffer, and bubs don't have to suffer. But I guess it's just about getting people more educated on this kind of thing, because you don't really hear about it at all, do you?
No, and that's a big problem, and unfortunately there are these sort of misconceptions around various things, like if a baby's able to put weight on around the time of infancy, even if there is a severe restriction in the mouth, I guess maybe a traditional approach is to sort of say, well, the baby's putting weight on, we don't need to worry about anything. Mm-hmm. I did a lecture a couple of weeks ago, and my whole purpose in that lecture was what's the impact of a restricted tongue throughout life?
Yeah.
So it's not just can the baby survive through infancy, it's more what's happening throughout the lifespan. So the tongue drives the growth of the jaws, you end up with a small jaw, and then the research shows that if we have small jaws, because the jaw is the gateway to the airway, we have airway problems, so we're more likely to end up with snoring and sleep apnea. And from your perspective as a chiropractor, we're more likely, if we have breathing dysfunction, to then subluxate the neck. And then, of course, the hips come forwards, and then you get lower back problems. And then you get pain in the knees, and then you get pain in the balls of the feet, and then you go and see a podiatrist.
Yeah.
And actually, it could have all started potentially right here, even before birth.
Yeah, so is this something that, I guess this is a question I get asked a lot when we're going through results with people and they have a look in their spine and their posture and all those sort of things. They see their x-ray and lots of people ask, is this like a genetic issue? Is there a genetic factor to this, or is it something that's happened in utero, or is it a nutritional process that's going on, or what's causing it, do you think?
You hit the nail on the head. It's kind of a combination of all of the above. But basically, we don't know the exact cause of it, but what we know happens is something metabolic is happening in utero. And normally what should happen is the frenum should sort of die away in this process called apoptosis, or programmed cell death, as an embryo. And it doesn't die away, and that remnant is left. It's a defect in the midline formation. So the embryo kind of comes like this and fuses together, and we have this frenum, and it should die away. We think there's a number of possible causes for it, but the reason there seems to be maybe an increase in prevalence, there's a couple of reasons. One is that breastfeeding is more and more popular these days. There was a time when it was sort of, you don't need to bother with that, whereas now it's becoming more and more popular for many reasons.
And statistically, that's true, is it? That breastfeeding's more like it's on the rise.
Yeah, that's right. So particularly post-war, there was a lot of since post-war, there's been a big increase in breastfeeding because of the health benefits that people are aware of, and the fact that it's becoming less taboo now to maybe start breastfeeding, in a cafe or when a mum's out and about in the public. It used to be very taboo, and it's less so now.
Yeah, it's better than condensed milk.
Yeah, exactly. It's obviously going to be. I mean, there's not really any doubt anymore about whether or not actual breast milk is better than formula. We know that. But just to go back to that point before, it used to be that babies would likely die in infancy. So we didn't have bottles or formula. And if we don't have bottles or formula, if there's no availability of milk, then those babies would have died. So that gene pool is being passed on, because fortunately now, if a mum is not able to feed for whatever reason, we do have a formula and we do have bottles. So these babies survive, which is great. But these babies who are surviving are passing their genes on. Lots of other reasons, things like folic acid. Use of folic acid is a potential one. It's used to prevent spina bifida. But the synthetic version of folic acid seems to be having an effect on a biochemical process called methylation. And again, no real research to prove that. It's only a theory.
Yeah, like a negative impact.
Yeah, the idea is that this synthetic folate seems to be blocking up receptor sites in this thing called the methylation process. And so instead of using more natural form, which is an active form of folic acid or folate, there is receptor sites are being blocked, and that's affecting the whole process around something called methylation, which is a biochemical pathway in the body. So various different reasons, possibly also another link with congenital hypothyroidism, so iodine deficiency disorders, creating congenital hypothyroidism, and then creating tongue defects. There was a research paper showing something along those lines. The reality is no one really knows, but there's all these different theories being bandied about, and what we do know, though, is that if there's a tongue tie and it's not adjusted, as in if surgery is not done to fix it, we can have lots and lots of chiropractic adjustments which will improve the symptoms, but that tie is going to be present throughout life. And so there's either a case of maybe going to the chiro over and over again to keep getting it changed. Or, ideally, the way I work is I like to work with body workers, so be it a chiropractor or an osteopath or a physio, and someone who understands about how to do the releases specific for a tongue tie. And before and after my procedure, I send my patient to the body worker. They do their bit, and then we kind of work together in an interdisciplinary approach to get the best result for our patients. You know, so.
Yeah, fantastic.
Yeah.
And so is there a lot of adults walking around potentially with tongue ties?
Absolutely.
Yeah, there is, yeah.
Absolutely. So I get adults come to me and they say, look, I've never been able to lick an ice cream. You know, I want to do the tongue tie for that reason.
Yeah.
Now, that brings me on to another point. It's very poorly diagnosed, so people traditionally think if you can stick your tongue out, you haven't got a restriction, and that's not true. We actually need to be able to elevate the tongue, so elevation is more important. But yeah, we get adults with head and neck pain, snoring, all those sorts of things, because the tongue is held too close to the airway, and that can have an effect on the airway patency.
Yeah.
So yeah.
And for the video here, Dan, are you able to demonstrate like what a how could you do a little self-diagnosis test on?
Well, it's pretty difficult to self-diagnose, but basically underneath the tongue here, you really want me to open my mouth? Is that what we're saying here?
Yeah, that'd be awesome.
Fair enough.
We've got the video right on Dan here.
Fortunately, I brushed my teeth this morning. So, okay, so basically we should be able to elevate the tongue into the roof of the mouth and kind of hold it there like this. That bit right underneath there, if that's too tight or too inelastic, it affects the ability of the tongue to be able to elevate into the roof of the mouth, particularly the posterior or the back section of the tongue is important to elevate. And so, it's very difficult to do a self-diagnosis. There's a bit of an art to diagnosis in it. But if you were to put your finger underneath that tongue and feel like it feels almost like a guitar string, that's possibly more of an obvious tongue tie. But we do get tongue ties that are what we call submucosal. Some people call them posterior ties. And that's kind of underneath there. And it takes a lot of skill and experience to be able to diagnose that. But often we look at the signs and symptoms and go, well, there's a high chance of a tongue tie, so let's go feeling for it. And then we feel underneath there and it kind of feels like a speed bump. But it's very hard to... Don't self-diagnose this. Go and find someone who knows what they're doing.
Yeah, that's great. And we'll get some links or some information on where we can actually send people to find someone in their area, wherever they're listening or watching in the world. And so, Dan, tell me about crooked teeth. Right? A crooked teeth. Obviously, we've got a prevalence of crooked teeth in the Western world, and I'm not sure in the third world, but from my research, particularly with things, research done by Weston A. Price, who was a dentist, who I guess was the sort of traditional paleo guy back a century ago nearly. He did the research on these traditional people eating what they were eating, and he did find that they didn't have crooked teeth or dental cavities.
Yeah.
Tell me about that. What's the deal with crooked teeth?
Okay, so basically crooked teeth are caused by what we call soft tissue dysfunction. So I said before about the muscles being like a sculptor and the teeth and jaws being like a lump of clay when they're growing. So the muscles need to be working correctly to enable the forces to be put onto the jaws as they're growing to stimulate normal jaw growth. So for example, if I can't use my tongue correctly for whatever reason, low tongue posture is going to create a more narrow top jaw. If I'm not using my tongue correctly, my lower lip, for example, might get involved more in my swallow than it should do, and that's going to then kind of push back here. That will cause my lower front teeth to crowd up, and it will cause my lower jaw to be pushed back. So when we get buck teeth, that's because the lower lip is pushing the lower jaw back too much. When we get a narrow top jaw, that's often the cheeks that are constricting in too much, and the tongue is not pushing upwards correctly. So anything that leads to soft tissue dysfunction, including breathing dysfunction. So if we're unhealthy and our nose is blocking up all of the time, for example, we're going to mouth breathe. When we mouth breathe, the tongue drops down low, and that makes the top jaw too narrow. Okay, so what Weston Price was sort of talking about was those traditional people were having a very healthy diet. They weren't getting loads and loads of coughs and colds and blocked noses and all the rest of it as children growing up. And so they weren't having this problem with so much mouth breathing. That's the first one. The other one is they're using a nice firm diet. So they were using the masticatory muscles correctly, and they were actually learning to chew their food properly. So much like if you had a puppy dog, the vet will tell us, make sure you give the dog some bones so it can develop its musculature correctly. It's the same with our newborn infants. They're having very soft, sloppy, refined foods. And when we do that, the muscles aren't being worked correctly, and we're not really developing that musculature correctly. But more to the point, if we're having an unhealthy Western-type diet, if you like, very refined diet, we're more likely to get sick more often. And when you get sick, nose blocks up, mouth breathing, low tongue posture, changes in swallowing pattern. So these traditional peoples have this amazing bone stature and this amazing, perfectly formed arches. And as babies, they were more likely they were breastfeeding. They didn't have bottles and formula, so they were breastfeeding. They weren't using dummies or pacifiers. So a dummy will create a low tongue posture and change the swallowing pattern, and so will a bottle. So.
And would you use? You've got children, don't you, Dan?
I don't. I have a very big dog though.
Good. And, well, for the parents listening, like dummies, like what is your your opinion on dummies? I'd love to hear it.
Okay, I've got to be careful now. So basically, as you know, I work with babies. That's mostly what I do, is work with babies these days on the tongue ties. And so I understand all of the pressures that parents have to go through with regards to sometimes using those things. I sort of joke sometimes with the parents I'm with, and I say, look, don't vote for me to be Prime Minister, because if I did, I would actually make a dummy a prescription item. And so it would be, okay, you're having problems settling this baby down, so no judgment of occasionally needing to use a dummy, because we've all got to live our lives, but using a dummy as a routine without a reason to be using it, it affects the way we swallow. So my opinion on those is that it's not that they should never be used, but when we use a dummy or a bottle, we should use it with the knowledge of what it causes. So it causes a change in the swallowing pattern, which then will create a change in the way the jaws and the face grows and the way the teeth come through. And that may have an impact on things like snoring and sleep apnea as we get older, because jaw formation affects that. So it's just use these things with the full knowledge of what they're creating. And sometimes you may need to use them. And I sort of joked before about being a Prime Minister and making it a prescription item. I don't really mean that, but I'm just sort of saying that it's very important that people understand what these things create. And if the baby is having trouble settling, the key is to get that baby checked for things like tongue ties, because that's a really big reason why these sorts of babies, these babies are having trouble settling. If they've got colic, wind, all the rest of it, very, very high chance that there may be some degree of that going on. And in my experience, when we treat those things, I get emails back from mums all the time saying it's like I've got a new baby here, this baby's so much better, and those sorts of things.
I mean, it's the same with parenting as well. If Bub's got some problems in the upper neck, and they can't tell you that they're in pain, they're just irritable and crying, and you clear out that problem, and then they turn into a whole new baby, what it appears to for the mum and dad, which is amazing.
Exactly.
And as well with the like the formation of the jaw and breathing, and then affecting snoring and sleep apnea and all that stuff like going on into adulthood. But it really affects, like, I guess, your appearance as well, doesn't it? I mean, when you think of a good-looking person, and for men and women, I mean, jaw structure is like one of the main things that people think of when they think of it, beauty and appearance, and having a nice, well-defined jaw is something to be desired for, I guess, and it has been for centuries. Poets and artists have represented that and spoken about this jaw structure as a sign of, I guess, health and beauty. And so I guess when you're needing to use a dummy or thinking about that, or maybe you're not, maybe you're pregnant, or maybe you're thinking about children, and I think it's a good idea to try and make decisions about what you want to do potentially, and get well informed before you have to make those decisions, because when you've got a screaming baby, and I've got a baby and they do scream, and you're tired, and sometimes you just will do whatever it takes to help that baby settle. But I guess if people are a little bit more well aware of okay, what are the consequences of me now using a dummy? I mean, we haven't used a dummy with our first baby Charlie, and we never have. But we've got another bub on the way, and who's to say? You just don't know. But I guess it's really good to be informed about okay, if we do decide to use a dummy for whatever reason, these are the consequences, and are we willing to live with that?
Yeah, absolutely. And the important thing is balance here in this discussion is that, you know, if I had a child, I'm not saying that I would never use a dummy and never use a bottle. If my child can't get nutrition from mum,
Yeah.
I am 100% going to use a bottle.
Yeah.
And if I can't get my child to settle down and you know, they're screaming like crazy and it's the middle of the night and I really can't do anything for them other than give them a dummy, then you know, there's a high chance I would do that if I couldn't settle them myself, you know. So it's important on balance on these things, but you're right, the whole facial growth and the jaws and everything else, you know, it's very rare these days that I actually see someone with who's fully expressed their genetic potential for their jaws. So by that I mean that we actually all have a genetic potential to grow a fully formed jaw and to have that really great jaw structure. But we have to set our environment up enough to be able to express that genome, and that's called epigenetics, where have the environment's effect on our genes able to express themselves. So
which is you've obviously have you read Bruce Lipton's book? Yeah, well, we've got Bruce booked in for the podcasting coming up.
Oh, awesome.
Yeah, so that'll be great.
Yeah, so I mean, basically, if I'm walking down the street and I see someone with a well-formed jaw, it's kind of like I do a double take. I'm like, oh my goodness. And I actually believe that every human being has the genes to be extremely attractive. I mean, every human being is attractive in their own way. But I mean, physically, sort of aesthetically, facially, I believe that every human being, except for some various strange syndromes and things like that, we're all set up to have these really well-formed jaws, but it's our environment that's changed. And that environmental change, as in the forces that are put on our face and jaws while we're growing as a result of how we learn to swallow, that force environment is what I'm talking about now, as opposed to the eco-environment kind of thing. But that force environment has an effect on how we grow, and it's our face that ends up getting changed.
I mean, yeah, that makes sense, because same thing with our bodies, like everyone's genetically set up to have a very attractive, you know, body for them. There's obviously lots of different types of bodies, but you know, everyone can have a very healthy, fit, aesthetically pleasing body, but same deal, there's not that many people walking around with that. You know, maybe you have to go down to World Gym down the road or something like that to see these days, because most people are overweight, most people suffer with either obesity or, you know, extra adipose tissue in you know, areas of the body that they don't necessarily want. But yeah, we're all genetically set up to have these great physiques, but it's our environment that we find ourselves in that doesn't allow us to express that as well. And if you're set up from a child with the wrong nutrition and diet, and you get into that obesity as a young kid, you're pretty much done for life. It's going to be very, very difficult to get out of that.
Yeah, it's amazing. I mean, I'm sure if you interview Bruce Lipton, he'll tell you this, but things like the environment our parents were in even affects things, you know. So if our parents were in an area of lots of food, so food plenty, they'll be sort of set up to be quick metabolizers. So you know, those sorts of things will alter our ability to metabolize. And so then if we go into an area of food scarcity, we're going to find it harder to survive. Or the other way around, if our parent was born into a time of famine, so if our parents were in maybe Africa in times of famine or something like that, and then we find ourselves in the middle of New York, sort of fast food city, we're going to be very slow metabolizers. That was passed on to us epigenetically. And when we're slow metabolizers and we're in an area of high energy, lots of carbohydrates and all the rest of it, we're going to become obese very, very quickly. So these things actually are affecting, they're transgenerational. So whilst we can change things in our own lifetime, what we do now actually affects our grandchildren. It's amazing.
Yeah, that's great. And if anyone isn't familiar with epigenetics, Biology of Belief by Dr. Bruce Lipton's an amazing read, and we will have Bruce Lipton on the show coming up in a few months. So that'll be really great as well. So, Dan, we've just got a few minutes. I want to just get a couple of, I guess, tips that people can do. You know, as a dentist, you know, what are some of the big things in terms of like I mean, everyone hates going to the dentist. Like, and obviously, if we can help people prevent things like tooth decay and things like that. I mean, there's so many great things that I'd love to go in, but time probably won't allow. But we might have to get you back in. But what can people do, and what do you think is the biggest things outside, of course, brushing your teeth? What's the big one for tooth decay?
I think a lot of people don't realise that it's not the quantity of sugar that actually really matters with regards to tooth decay. It's actually the frequency. So the mouth is set up in most cases to be able to neutralise acids in the mouth. So the acids are formed from fermentation of sugars. So bacteria gets hold of a sugar, it ferments it, and acid is formed from that bacteria, and that's what rots tooth. Most people's mouths are set up so that their saliva will neutralise those acids, and it takes maybe varying degrees of time, but a short period of time, maybe half an hour or so after eating, and the mouth will naturally start to neutralise those acids, and then everything's safe again. The problem comes when so say for example, if someone said to me, I have to drink, right now I have to drink a half a litre of Coke, and there's two options of how we can drink that. One is we can have a bottle top and we can maybe just have a sip of it every 5 minutes and we can let it spread throughout the day. Yeah. Or I can down the bottle right now in front of you. I'm going to completely down it and then throw the bottle away. Whilst both of those scenarios are really bad for the body in general because of what you're putting into the body, I certainly don't recommend having bottles of Coke. But in the second scenario where you're having it all in one go, that is going to have less of an effect on your tooth structure throughout the day. Yeah, because after having that initial insult, if you like, the saliva is then going to then start neutralising. So I'm not saying go out and down bottles of Coke by any means, but I'm just using that analogy as a kind of like having a small amount of sugar frequently throughout the day is far more damaging than having, say I'm going to treat myself, say it's my birthday, I'm going to have a birthday cake. No big deal having a couple of big slices of that birthday cake after my dinner and really enjoying that moment and kind of being present with that food and celebrating, and that's another thing of being present with the food, another topic of conversation there. Yeah. But basically having that big amount in one go is great. Having a little bit of it and throughout the day, that's not so good.
Yeah, right, okay. So just down your cakes and your Coke in one sitting.
Try not to have those things whenever possible. Let's eat healthy. But I'm just saying, if we've got those two scenarios, as far as damage to the teeth goes, not having it frequently is important.
Yeah. And what about wheat?
Okay. What about wheat with regards to teeth?
Yeah, like is wheat. I mean, obviously we know that the damage effects wheat can have on other areas in the body and insulin sensitivity and gut health and everything. Does wheat affect the teeth? Because I mean, you think of I guess things that damage the teeth is more like sugary stuff. Like if eating a white bread sandwich, does that have much effect on the teeth or not so much?
Well, if you've got poor gut health in general, so whether you've got, gluten and dairy and all these other things potentially are affecting people's guts a lot these days. If you've got poor gut health, then generally your body's going to be in more of what we call a sort of sympathetic fight-flight mode because the gut's so hooked into the nervous system. And if your body's in this sort of sympathetic dominant fight-flight mode more often, then you're less likely to have good quality saliva, for sure. Yeah, right. And so that's a big factor. So the importance of sort of full body health, the ability to have good quality saliva is very, very important. With regards to wheat itself, that kind of, the gluten and all these gluten sensitivities that people have, and I have it myself, is certainly having an effect, but I don't think that's specifically directly causing tooth decay. Yeah. But if you have that real kind of white refined bread, there's a lot of sugars in that, and that potentially could be adding towards tooth decay.
No worries. No, that's great. Dan, it's been an awesome discussion, and I think we've got heaps out of it. In terms of people being able to find someone like yourself, I guess it's different to find you if you maybe live on the other side of the world or elsewhere in Australia. But so is there a website or is there some resources that people can find other practitioners that do the type of dentistry work that you do?
There's lots of different practitioners that do some of the work that I do. There's all the stuff that I work on children for preventing braces and all the rest of it, which we sort of haven't talked about today. Yeah. But there are heaps of different networks. Probably the easiest thing to do is, depending on what you want from your dentist or your health practitioner, would be to contact me, really. Okay. Yeah, there's lots of people who do certain elements of what I do. Yeah. And we're in the process of forming a large group of people with what's called the Tongue Tie Institute, which I'm a co-founder of. Mm-hmm. And the website for the Tongue Tie Institute would be a place to certainly look for practitioners with regards to that stuff that we talked about earlier.
Yeah, cool. And in terms of like crowding of the teeth, I mean, most people think that, I guess, braces is the really only option. But that's not necessarily the case these days, is that?
No. My other job, aside from the tongue ties, is working on kids between about the age of 5 and 10. And I'm establishing normal swallowing patterns in those kids and helping to prevent braces. And the technique I use is called Myo Brace, MYO brace. People can certainly look on websites there, myobrace.com. Yeah, that's a really great technique. I'm fortunate enough to travel the world teaching dentists and orthodontists how to do that method, how to actually employ it into their practices.
I've been up to the Myo Brace up here in the Gold Coast, and it's an amazing facility.
Oh, it's brilliant. It's kind of like Disneyland, you know. Yeah. It's really great for the kids. Yeah. That sort of technique is really fantastic. It's a great way of getting the jaws growing and sort of setting the jaws up for the teeth to come through. And in about 95% of cases, we don't need to place braces when the child is able to do what we ask them to do.
Well, and so what age should parents bring their kids in to get checked and say Myo Brace?
About age 5 or 6 is great, but the majority of the people we end up seeing are probably about age 9 or 10, because they kind of have been put on that kind of waiting list kind of thing, you know. Yeah. But 5 or 6 is a fantastic age to start looking at it, and then starting treatment around then, or maybe just a little bit later, depending on the individual case, you know.
Yeah. And I'd love to know this as well, Dan, with kids, like when did kids, like young kids, I guess, need to start brushing their teeth? And how important is brushing your teeth?
Okay.
Double question.
All right, double question. So when should they brush? The answer to that is basically when the teeth start coming through. So the parents should start getting involved with a little bit of sort of playing with the toothbrush around that sort of time. Mm-hmm. So teeth typically start coming through, obviously in the first year of life. Mm-hmm. So very early on. Provided the child's not having any refined sugars at that point, which I don't really think they should be, usually. I don't really think you need to go sort of using too much toothpaste and things like that at that time. Okay. I think I'd be just kind of brushing any stuff that's on the teeth
just
with the brush.
The big stuff off.
Exactly. Yeah. And then, the child should really start looking at going to the dentist, or the parent should take the child to the dentist. I think, personally, around about age sort of 2. To start getting acclimatized more than anything. So all of the baby teeth are normally through at that time, or pretty much all of them. And it's a good idea to start getting the child acclimatized to just being in the chair. And if they've got a dentist who takes time with patients to sort of look at their well-being beyond just their teeth and gums, and actually trying to acclimatise them to the treatment, then that's really, really important, because we're trying to develop a generation of children who aren't scared of the dentist. So these days there's certainly no reason to be scared of the dentist, taking your child early on to a dentist is really going to take some time over those sorts of things is a great first step.
Okay, great. And you've sort of answered the second part of the question, which is obviously brushing your teeth is an important thing to do.
Yeah, well, it is important, but then if we're eating extremely healthily and we're not having refined sugars and so on, for me, the reason to brush the teeth is more kind of to refresh, to freshen things up, and to help the gum health. I once had a patient who hadn't brushed his teeth in 30 years when I was a dental student. And whilst there was lots of stuff I had to clean off of his gums, and his gums weren't healthy, really interestingly, he had no cavities because of the diet he'd been having. So really, I'm not saying don't brush your teeth, but I'm just sort of saying let's put it in perspective that what the stuff that we actually put into our body, I believe, has a much bigger impact on the health of the teeth.
So the foods essentially that we're eating.
Yeah, exactly. Yeah. If we've got a rotten tooth, then we've got to think what's going on in our gut. If something can create damage to the hardest tissue in the body. You know, that's something that's not really meant for our body.
No.
So, so we've got to really think about what we're eating. But do brush your teeth, very important.
That's great. Dan, thanks so much for joining us on the Innate Doctor today.
Thanks very much for having me.
Yeah, no worries, mate. And stay tuned for the episode, guys. We'll be posting this very shortly. And thanks again, Dan.
No worries.
Cheers.
Thank you.
Thanks all you wellness warriors that have been tuning into the Innate Doctor podcast, wherever you are out there in podcast land. So if you're interested in getting my new ebook, it is currently in creation mode. So stay tuned for that on Facebook. If you haven't checked out the Facebook page or the Instagram page, we'll be releasing the announcement when that is coming out to you. There will be a short period of time where that'll be free, right for you to download, and it's going to be jam-packed full of innate goodness. So look forward to sharing that with you. And head over to the Innate Doctor website, rate us on iTunes if you haven't so far. We would love your help with spreading the message. So once again, thank you. We have some amazing interviews in store for you coming up very soon. I can't give you the exact details yet, but we have some exciting guests coming to the show. So hope you're getting a lot out of it. We will see you at the next Innate Doctor show.
Thanks for listening. Dr. Trent Headlam is the Innate Doctor. If you enjoyed this episode, please rate and subscribe to us on iTunes. And for heaps more life-changing stuff, go to www.theinnatedoctor.com. Join Dr. Trent at the next episode. Have fun getting healthy.